The MANIFEST study is a study of a drug called CPI-610, which is a bromodomain inhibitor. And arm 3 of the study is for patients who are treatment naive. So they have not had any exposure to JAK inhibitors prior to initiation of the study. And so these patients were initiated on both Ruxolitinib and CPI-610 or Pelabresib at the same time. As of data cut in September of 2020, a total of 78 patients have been started on therapy in arm 3, and 85% of these patients remain active on treatment with a median treatment duration of 40 weeks. So majority of patients enrolled had DIPSS intermediate to a high-risk score, and based on the mutational profile, most patients, 55% or so, carried high molecular risk mutation. The median hemoglobin level at enrollment was relatively low at 9.1. What's really exciting is that at 24 weeks of treatment, 67% of patients achieved 35% reduction in their spleen volume, with a median spleen size reduction of 50%. Patient subgroup analysis showed that spleen reduction at week 24 was consistent across different subgroups. And this was regardless of patients' demographics, such as gender or age, baseline disease characteristics such as risk score, subtype of MF, baseline spleen size or platelet count, or even the molecular features. Anemia is one of the leading causes of ruxolitinib discontinuation in clinical practice. What's interesting here is that in overall patient population of arm 3, the combination therapy of ruxolitinib and CPI-610 led to small initial decrease in hemoglobin and then return to baseline over time. Most patients experience symptomatic improvement with 57% response at week 24. The median improvement in TSS at week 24 was 59%. To assess the impact of treatment on disease progression, bone marrow samples were evaluated, and this was done by central pathology review. And 33% of patients had at least one grade improvement in bone marrow fibrosis. The drug was generally well tolerated. The most common treatment emergent adverse effects were generally grade 1 or 2 and included anemia and thrombocytopenia. Some of the other adverse events were diarrhea, dysphagia, and asthenic conditions. It's exciting because CPI-610 or Pelabresib treatment in combination with ruxolitinib in JAK inhibitor-naive patients resulted in similar spleen volume reduction at week 24 across all patient subgroups compared to overall population. In addition to that, we're seeing some improvement in bone marrow fibrosis that could suggest potential disease modification of this drug.